Hello everyone, welcome to my channel. I am Paul, an international medical graduate currently pursuing my medical license in North America. Today I am going to discuss a very important topic for MCCQE1 exam, that is ethics. In my previous video I mentioned what resources I use for my preparation. If you haven't watched yet, check it out. Link is in the description box. Now I will discuss what I studied from CPSO website. Let's jump into the video. A quick disclaimer, this video is made completely based on what and how I studied for my exam. For details, please visit CPSO website, link is in the description box. It's a huge website and lots of information. I tried to cover these topics in this video. Before starting, please like and consider subscribe to this channel and watch the video till the end. So as a physician, while accepting new patients, we should use a first-come, first-served approach. We must abide by Ontario Human Rights Code, which prohibits discrimination against age, sex, gender, race, origin, or whatsoever. And also, we must not unfairly refuse patients with complex, critical, chronic healthcare needs. But some physicians' practices are focused on treating certain groups of individuals such as female or geriatric patients. In that case, refusal on this basis likely would not infringe the Human Rights Code. So what is the educational objective? Right. While accepting new patients, we must use first come first serve approach. We cannot discriminate. We cannot refuse patients based on complexity. Now, anabolic steroids, substances and methods prohibited in sport. As a physician, many patients will come to us and ask about prescribing steroid or anything else just to enhance performance in sport. As a physician, without clinically indicated for medical purpose, even under pressure, we must not prescribe, administer or provide assistance relating to the use of substances or methods commonly known as doping. So those who are interested to learn more about that, please visit Canadian Center for Ethics in Sport and also World Anti-Doping Agency websites. Now, bloodborne viruses. This topic is so important for us. What are the bloodborne viruses? It refers to hepatitis B virus, hepatitis C virus, and HIV. Bloodborne viruses policy applies to physicians who perform or who assist in performing exposure-prone procedures. There is a long list of that, but generally those have the potential to expose patients' open tissue and blood. Those are actually considered as exposure-prone procedures. And few are considered non-exposure-prone, like history taking, physical examinations, routine rectal or vaginal examinations, minor suturing, insertion of arterial or central venous line, and many more. Probably they are not gonna ask which are exposure prone or which are not, but we have to have some idea about that. So how can we prevent bloodborne viruses? Routine practices. It includes hand hygiene and use of personal protective equipments like mask, gloves, goggles, depending on individual risk assessment. It also includes safe handling of sharp instruments, cleaning, disinfection of equipment, and environmental surfaces between uses of each patient. Hepatitis B virus vaccination for physicians. It is strongly recommended that physicians who are not currently and have not previously been infected with hepatitis B virus be immunized for hepatitis B virus and tested to confirm the presence of an effective antibody response unless a contraindication exists or there is evidence of prior immunity. So when to screen for bloodborne viruses? Right at the very beginning, before performing any exposure-prone procedures. So how they can ask questions from here? They will give a scenario like you are a first-year surgical resident about to start or assist exposure-prone procedures and previous lab value showed immunity to hepatitis B virus. Now what are the bloodborne viruses you need to be tested? Right, HCV and HIV. So once you have entered into practice, how often you need to test for viruses? It is recommended for HCV and HIV every 3 years, and for hepatitis B, it is annually unless the physician has been confirmed immune to hepatitis B virus. So as a physician, it is possible that we can be exposed to patient's bodily fluid, and in that case, under the Mandatory Blood Testing Act, we may be able to have the patient's serological status confirmed. So this is the exception of taking consent from patients before performing any test, especially HIV. And I would highly recommend to learn about post-exposure prophylaxis to physicians like for hepatitis B virus and HIV. Reporting serological status for seropositive physicians. When a physician learns he or she is seropositive for HBV, HCV or HIV, they are expected to report to college as soon as reasonably practical. In that case, college will convene an expert panel, and at the same time, the physician will have the opportunity to make representations and to provide his or her own expert's opinion if he or she wishes to do so. Now, based on the serological status of the physician, if the college does impose restrictions on a physician's practice, it will ensure that the institution at which the physician works are aware of the restrictions. The college generally does not make institutions aware of the details when a physician poses no increased risk and is subject only to health monitoring to ensure the risk level stays the same. Now from here, how they can ask questions like when to inform the institution. So the educational objectives are: what are the bloodborne viruses, when to test and how often, when to report seropositive status to college, and about post-exposure test and prophylaxis. Now a little bit about, as a physician, what is our job when we need to take leave. It could be due to educational leave, sabbatical, parental leave, extended illness, practice closure due to relocation or retirement. This policy also applies to physicians whose certificates of registration have been affected by a suspension, revocation, or voluntary commitment to suspend practice. So what are the policies? The first step is notification. Notification to patients as well as employers, hospitals, colleagues who also provide care to patients of the physician. That notification could be in the form of in-person, through letters, or telephone call. We should also make sure that the patients have the access to medical records, getting ongoing cares, follow-up of laboratory tests, those are pending, and also refill of prescriptions. So how can we do that? We can refer the patients to a colleague who will take care of the patients at that time. Now, what about complementary or alternative medicine? Patients have the right to make healthcare decisions that accord with their own values, wishes, and preference. The Medicine Act 1991 states that physicians shall not be found guilty of professional misconduct or incompetence solely on the basis they practice a therapy that is non-traditional or that differs from the prevailing medical practice. But the college expects physicians will practice the profession in a manner that is informed by evidence and science and is in keeping with professional, ethical, and legal obligations. Sometimes patients take alternative medicine of their own, and as a physician, if we see that is causing harm to the patient, we should encourage the patient to stop that medicine. Now, confidentiality. I cannot emphasize how important it is during our professional life as a physician, as well as during exam. We have the legal and professional obligation to maintain patient confidentiality set out under the Personal Health Information Protection Act 2004, also known as PHIPAA. So what are the principles? Number 1, physicians must act in accordance with all their professional and legal obligations. Number 2, to establish and preserve trust in the patient-physician relationship, patients must be confident that their personal health information will remain confidential. And number 3, maintaining confidentiality is the fundamental to providing the highest standard of patient care. Now, when a physician can disclose patient's personal health information. To disclose personal health information, a physician must take consent either from patient or their substitute decision maker. A physician can also disclose where it is permitted under legislation without consent or where it is required by law. We will learn more about when to disclose. Regarding consent, generally physician needs express or implied consent, and he or she can share information with others involved within the patient's circle of care without asking the patient's consent. So I mentioned that physician can share information within the circle of care without consent of patients. But this is not always true due to lockbox. What is lockbox? It applies to situations where the patient has explicitly restricted his or her physician from disclosing specific personal health information to others, even to others involved in the patient's circle of care. Now, what is the message from here? Let me give me an example. You are working as an emergency physician in a hospital. A 30-year-old patient presents to you. You diagnose the patient as a case of gonorrhea. Now the patient wants you not to inform his or her family physician of the condition. What will you do? You will not inform the family physician, but you must have to report somewhere else. Think about it. Where is that somewhere else? In case of lockbox, can physician refuse treatment? Yes. If the lockbox creates a situation where the physician feels the patient's safety is at risk, the physician can refuse to provide treatment when it is not an emergency. The physician should explain the reasons of his or her decision not to treat the patient and note in health record. It is to be noted that patients may not prevent the physician from disclosing personal health information permitted by law. So, as I mentioned before, it is our professional obligation to maintain patient confidentiality under PHIPAA. But PHIPAA also allows the disclosure of personal health information under certain circumstances. But college advises physicians, whenever possible, we should make every reasonable effort to obtain the patient's consent before disclosing any information. Now, what are the circumstances? Exceptional situation like emergency condition, when it is not reasonably possible to obtain patient's consent in a timely manner unless the patient has expressly instructed the physician otherwise. Now, disclosure related to risk. So what does that mean? That means when a physician believes that one of his or her patients is planning of serious bodily harm to a person or group of persons, the physician should inform the police and in some instances to the intended victim. Let me give you an example. Say you have been practicing as psychiatrist and a patient of you having mood disorder or other psychiatric problem mentioned to you that he is gonna kill his neighbor or planning to kill him. It is the duty of the physician to disclose this information to police and also the victim. Now the required disclosure like required by law. Mandatory reports. There is a list of conditions where a physician required by law to disclose personal health information without the consent of the patient. Commonly Highway Traffic Act, Child and Family Service Act, Aeronautics Act and many more. Here is a flash quiz for you. Say a 70-year-old gentleman presented to you having vision problem and difficulty understanding traffic signal but still wishes to drive. What do you think? Comment down below. In case of summon, subpoena and court orders, physicians should also disclose personal health information, but keep in mind summons does not authorize the physician to discuss patient care anyone in advance of the court appearance. Few more conditions about disclosure, like with respect to incapacity. When physicians have reasonable grounds to believe that another physician or healthcare professional is incapacitated, the college expects physicians to behave ethically and take appropriate action. Appropriate action may include contacting physician health program, CMPA, or other relevant regulatory college, or individuals' family and friends. Physicians are also advised to exercise caution and ensure that they uphold their obligation under PHIPAA. Now, disclosure to police. It is not mandatory for physician to provide confidential material to the police in the absence of legal obligation like consent from the patient, reporting obligation, search warrant, or summons. Now, in any case, if the physician is uncertain whether disclosure is appropriate or not, the physicians are advised to contact the college physician advisory service, their lawyer, CMPA, or Information and Privacy Commissioner of Ontario. So, under the Regulation of Medicine Act, it is considered as professional misconduct if, as a physician, we cannot protect confidentiality of personal health information of patients. In my next video, I am going to cover these topics. To get videos like this, please like, comment, share, subscribe, and turn on notification bell. I really appreciate your feedback. Thank you so much for watching.